Hi Tyndall, thanks for joining us today. I know I'm going to be asking you some questions about training special population clients. Now I know that as a personal trainer they need to acquire a specific skill set in order to assist their clients in dealing with high levels of stress, depression, and anxiety. And this all seems to stem from work pressures and anything that's happening in their personal lives. And within that it increases levels of distress, which is your bad stress. And then within that, people tend to lean towards emotional eating, which means that they make bad dietary choices. And so that's when the cycle starts, and in the long run, it actually puts them at risk of health conditions such as obesity, hypertension, also known as high blood pressure, diabetes, and so on and so forth. So my question from me to you is, how can a personal trainer assist the client in achieving eustress, which is your good stress, in clients' lives?
Okay, I think that's a very interesting question, and you can probably take it from a variety of angles, but I'm going to take it from a slightly different angle, which I guess one would expect. So some of the keywords that came up were, for example, distress, eustress, exercise as medicine, hypertension, and diabetes. So the first thing, the concept I'm going to use to tie this all together is something called homeostasis. Have you heard of something like that before, Sarah?
I have heard of it before, but I would love for you to go into a little bit more detail and give us a little bit more insight on what homeostasis is.
Okay, so our bodies are pretty amazing in the sense of that it can adapt to the external environment.
So Tyndall, how would we modify an exercise program for a client who does have hypertension so that they're able to exercise safely and effectively, but still achieve their goals?
Alright, so there's 4 things that you need to consider. The first thing is right even before you start training the client is during your screening and when you're busy with your client's medical history. You need to jot down the types of medication they are using or the type of hypertensive medication. The reason for this is because each form of medication will have a different effect on the body and will possibly affect the person's exercise response. For example, beta blockers will result in a reduction of heart rate as well as a reduction of blood pressure. So if you're working with someone who's been taking beta blockers and you know this, you know if when you push them really hard, they may not be able to go past a certain point because their heart rate can't increase anymore. Another person may take diuretics, for example, and diuretics has no effect on the heart rate and will only result in a reduction of blood pressure, which you will be observing.
Okay.
So do you understand the importance it is of knowing what type of medication it is? And it's wonderful these days because we've got Google, so even if they write down the medication, you can go find out what drug class it falls in.
Definitely.
The second thing that you need to consider is that for a hypertensive client, you want to measure their blood pressure before, during, and after training. When you're measuring it before training, make sure that the client is in a rested state, they're seated state, and also know that there will be differences in their blood pressure when they're standing, when they're lying down, and when they're sitting. And it basically just comes down to the effect of gravity. So when you're standing, your blood pressure will be higher because your body basically has to work against gravity to get the blood back to the heart. Right, so always make sure the client is in the same position when you do take their blood pressure and in a rested position.
Okay.
You also do this just to make sure that their blood pressure is not too high to exercise. Now generally, according to the American College of Sports Medicine, 220 over 110 millimeters mercury is an absolute contraindication for the client to perform any form of exercise. This is now the upper limit, so I would recommend for a personal trainer around 160, 180 over 100 just to take care would be a safer option. So when that occurs, rather refer the client to an allied health professional. Next step is to take the blood pressure during exercise, and the reason why you do that is basically it's almost like a vital sign. So with increases in exercise increments, you should observe an increase in blood pressure as well. If you increase the exercise increment and blood pressure drops, you know that there's a big problem and you immediately stop exercising. The last time that you take blood pressure is after the cool down. Hypertension is quite common in your elderly individuals, and they tend to require a bit of a longer cool down than your average folk. So about a 10-minute light walk or light cycle with some static stretches would be the ideal cool down. After the cool down, have your person seated, wait for about 3 or 4 minutes for their heart rates to lower, and then take their blood pressure. You should find that the blood pressure has dropped compared to the first reading. This is really nice for the client because they can see the effect that an acute bout of exercise has on their blood pressure, so it can be quite motivating. And then lastly, it would be ideal if you record each of these values, because slowly but surely over the long term, you should find that there will be a drop in blood pressure, which is also a good objective way to see whether your program was effective or not.
Okay, great. And in terms of exercise choice, what are they limited to and what can they do?
Alright, so the mode of exercise, so the type of exercise is very important to consider. And according to research, your aerobic activities, so your cycling and your walking and your running even, are the preferred types of mode of activity to use as compared to strength training. So you would want your client to keep their heart rate between 60 to 70% of their maximum and try train for half an hour to 60 minutes on most days of the week. Some of the exercises you also need to avoid whilst training is, for example, the Valsalva maneuver, because it results in a very high spike of blood pressure while you're doing it. Also isometric exercises, which can also spike blood pressure, and any overhead exercises, something like a shoulder press and the lat pull down.
Okay, all right, great.